Tizanidine is an alpha-2 adrenergic agonist used for the short-term treatment of muscle spasticity. In this video, let's find found. What is Tizanidine? What is Tizanidine used for? Contraindication. What are the side effects of taking Tizanidine? How does Tizanidine work? How to use Tizanidine? What is Tizanidine? Tizanidine, sold under the brand name Zanaflex among others, is an alpha-2 adrenergic receptor agonist, similar to clonidine, that is used to treat muscle spasticity due to spinal cord injury, multiple sclerosis, and spastic cerebral palsy. Effectiveness appears similar to baclofen or diazepam. It is taken by mouth. Tizanidine was approved for medical use in the United States in 1996. It is available as a generic medication. In 2020, it was the 84th most commonly prescribed medication in the United States, with more than 8 million prescriptions. What is Tizanidine used for? Tizanidine is indicated for the relief of muscle spasticity, which can interfere with daily activities. The general recommendation is to reserve Tizanidine use for periods of time when there is a particular need for relief, as it has a short duration of action. Contraindication. Tizanidine is contraindicated for patients known to have hypersensitivity to Tizanidine or its ingredients is a contraindication to the use of Tizanidine. Tizanidine use requires caution in patients with hepatic impairment. According to product labeling, Tizanidine use requires caution in patients with renal impairment, creatinine clearance less than 25 milliliters per minute. Side effects. Side effects include dizziness, drowsiness, weakness, nervousness, confusion, hallucinations, strange dreams, depression, vomiting, dry mouth, constipation, diarrhea, stomach pain, heartburn, increased muscle spasms, back pain, rash, sweating, and a tingling sensation in the arms, legs, hands, and feet. Pharmacodynamic. Tizanidine is a rapidly acting drug used for the relief of muscle spasticity when it is required for performing specific activities. It acts as an agonist at alpha-2 adrenergic receptor sites and relieves symptoms of muscle spasticity, allowing the continuation of normal daily activities. In animal models, Tizanidine has not been shown to exert direct effects on skeletal muscle fibers or the neuromuscular junction, and has shown no significant effect on monosynaptic spinal reflexes, consisting of the communication between only one sensory neuron and one motor neuron. The frequency of muscle spasm and clonus are to be decreased by Tizanidine. Tizanidine shows a stronger action on polysynaptic reflexes, which involve several interneurons, relay neurons, communicating with motor neurons stimulating muscle movement. Mechanism of action. Tizanidine reduces spasticity by causing presynaptic inhibition of motor neurons via agonist actions at alpha-2 adrenergic receptor sites. This drug is centrally acting and leads to a reduction in the release of excitatory amino acids like glutamate and aspartate, which cause neurofiring that leads to muscle spasm. The above reduction and excitatory neurotransmitter release results in presynaptic inhibition of motor neurons. The strongest effect of Tizanidine has been shown to occur on spinal polysynaptic pathways. The antinociceptive and anticonvulsant activities of Tizanidine also be attributed to agonist action on alpha-2 receptors. Tizanidine also binds with weaker affinity to the alpha-1 receptors, explaining its slight and temporary effect on the cardiovascular system. Half-life. Approximately 2.5 hours. Dose. Muscle spasticity. Spasticity associated with multiple sclerosis and spinal cord injury. Initial, 2 mg, POQ6-8HR, PRN, no more than 3 doses, Q24HR. Maintenance, titrate in 2 to 4 mg/day increments to optimum effect with minimum 1 to 4 days between dose increments. Not to exceed 36 mg per day, single doses greater than 16 mg not studied. To discontinue, taper gradually, decrease by 2 to 4 mg daily. Half-life. Approximately 2.5 hours. That's all the information about Tizanidine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.